with this trial and with the LimFlow technology, what are some of the challenges that come with these late-stage CLTI patients?
So CLTI refers to critical limb-threatening ischemia. It's essentially the last stage of vascular disease, and at least 15 to 25% of these patients present in a situation where they have some form of tissue loss or severe risk of losing their limb, and they have no option for revascularization in the standard strategies that we use. And those standard strategies are often intervention or endovascular therapy or surgical bypass grafting. And a significant percentage of these patients really have none of these options available to them.
What's been your own experience in the venous arterialization, and what got you interested in the LimFlow procedure in particular?
So venous arterialization is a mechanism to allow us to try and deliver oxygenated blood flow to the feet through the venous system rather than through the arterial system. So normally when we do revascularization, what we're trying to do is to restore blood flow through the arteries. The blood goes into the capillaries of the foot, provides oxygen to the tissues, and then returns through the veins. But these patients have no arteries in their foot that they can deliver oxygen to the capillaries. So what we're doing in this situation is using the veins, which normally carry blood flow from the foot up to the heart, using those veins to carry blood flow into the foot to try and deliver oxygenated blood flow to the tissues of the foot. And what got me interested in that is that there is a significant group of patients who have no option for revascularization, and their risk of amputation is incredibly high. In the group of patients who are enrolled in the PROMISE 1 trial, not more than 90% of the physicians taking care of these patients felt that those patients would have lost their limb did they not have some other attempt, and that attempt is really through venous arterialization.